So we have a great panel today. There was a great conversation that was taking place just a few minutes ago about the relationships between the payer and the patient and so on. And then this conversation really is going to tie in from a technical perspective as well as enabling the patient even further from a technology standpoint. So we have a great panel. I'm going to ask the folks to introduce themselves, and we'll start with Steve.
And good morning, everyone. Thank you for joining us. My name is Stephen Lazer. I am the Global Healthcare CTO for Dell Technologies. With that, I've spent my last 20 plus years in healthcare, working with healthcare from either a nationalized perspective, localized perspective, private, public, and like it or not, healthcare challenges around the world are very much the same, even as we look at nationalized healthcare systems. From a background perspective, I've been working in technology for more than 30 years and really have been applying that to healthcare for the last 20 plus years. Thank you.
Thank you, Steve.
Hey everyone, my name is Taylor McPartland. I'm the CEO of ScaleLA. We are a health innovation ecosystem based in Los Angeles, currently working with about 100 early and growth stage healthcare, medtech, wellness startups and tech companies. And going into 2020, we're going to be expanding into the Orange County, Irvine area, as well as overseas, opening up a location in Ho Chi Minh City. And I'm honored to be here, and we are a proud partner of CPHIMS. So thank you for letting me join.
Thank you. Mike?
My name is Mike Holmes. I'm with Sirius Computer Solutions. I'm a principal consultant there. We're a system integration company. We're IBM's largest business partner. We have a very dedicated and deep healthcare practice, which includes a facility. We actually have a tech facility with Memorial Care in Orange County here. And I've been working to develop our blockchain framework for the last 4 years. And definitely healthcare, both payer, provider, malpractice, about every angle you can think of in healthcare has probably been the largest by number of participants that we've had discussions with.
Hi everyone, my name is Jason Ortiz. I was the CIO for Immigration and Customs Enforcement for Homeland Security as my origins in health IT. Quite a complex organization that was, and quite an experience. And then after my time with immigration, active duty, I transitioned to Sharp, where I served in clinical applications for 4 years, and now I'm a free agent looking for my next opportunity. Happy to fill the gap with that clinical experience, that clinical and acute care experience. So that's my background.
Great, thank you all very much for giving your background. So just kick us off, there was a question towards the tail end of the other panel regarding the medical records. Who should maintain the data and whatnot. Some folks responded the patient should have it, others a different response. So I'll start off with the first question for the panel. What innovative solutions or apps have been the most influential when it actually pertains to impacting digital transformation from your standpoint?
From an innovation perspective, I think things are about to change very dramatically. And I mean very, very dramatically. The enablers for technology to start to drive healthcare in a very different fashion than where it's been and where we've been for the last several years are just about to come out. You're starting to see the emergence of new technologies, things like 5G technology, things like edge-based computing, things like, take for example, an autonomous vehicle. What would an autonomous vehicle be doing in healthcare? Think about it delivering meals. Think about it delivering drugs on a stat perspective. Think about any number of activities that are routine and possible for it to do as you start to think about how we apply technology to care. So innovations are going to come from places that you don't necessarily expect them to come from. At the same time, the ability to go ahead and make that data accessible, make it viable, not have to transport it, because that's been one of our biggest challenges, is how do we get data from the individual silos back to where we want to utilize it to make sense of something? All those things are about to change. It's a very, very exciting time from my perspective.
Yeah, I would absolutely build on that. And just to give 2 quick examples of companies that we have founded here in Southern California area, the first being Headspace and really being able to destigmatize and deliver behavioral and mental health solutions right into the homes of people that need it, and giving them an opportunity to realize that, hey, there are resources out there without me having to go out and go into a hospital to seek out professional care. I've got the tools right in my hand right now. And the other being a great company called Giant. I think we're going to have the CMO speaking in a little bit here, Dr. Alan Young. But what they're doing around telemedicine and being able to allow our smartphones, with the increasing availability of 5G, to be able to provide that first gate, that first opportunity for someone to be able to find a resource at home on their couch in their bed without having to go into a hospital and take up those resources for someone who might actually really need critical care in that moment, I think is a huge benefit, and we're only going to start to see more of that.
So I mentioned blockchain, but I, to this audience, from what I've listened to this morning, I probably approach this answer a little differently, because people talk about all the last panel, all the technology to leverage it that's out there. The biggest challenge that I encounter is the willingness in healthcare. Again, don't throw anything at me, but to change process. For our blockchain initiatives, basically to even introduce the technology, it's what are you dramatically changing in process, and especially across enterprises and participants. The best example is healthcare, because you've got payers, providers, you've got people who have do have silos of information, pockets of information, but and they all want to do their own thing very well. They also need something very badly from the other side to get paid and to get the services done. And it's just that overall process, and you're never going to have a single system that spans all of that, but there are technologies like blockchain that do span that. And if you use the examples in the other industries like supply chain and food safety, it's the same kind of thing. Every one of those, from a farmer to a shipper to a warehouser to the stores, has their own thing they want to do. They all have their own systems. They really don't care as much about what everybody else does other than it being right. And I see the same kind of thing in healthcare. So I think a lot of it is changing processes, getting a governance together where everybody can agree across that space. And that's what I see as more of the focus.
Yeah, absolutely, and we'll touch on blockchain also later on in the discussion. Jason, any response?
Well, I think the most interesting technology for precision medicine is really genomics and the utilization of genomics to achieve a high level of precision medicine. I have a personal experience when my firstborn had some severe mental health conditions, and of course going into the hospital, I'm lucky enough to have had that genomics test done for him. And at the time, there's a standard practice to really review meds and change them, but because of those genomic profiles, they were able to kind of pinpoint a pretty significant genomic to medication issue that was avoided because of it. So I think that is one thing. And the second thing, that patient-specific information that's collected with Internet of Things, can be a huge barrier to how we use that data is really difficult. It's like getting influx from too much information, right? What is relevant and reasonable? How do we make sure that as that information exists, that it's actionable, right? Because even in the previous panel, there's concern of all this information coming at you. How do you effectively process it? Is there impacts of not processing it properly, right, on overall patient care? If you missed something that's out there, right, what are the impacts of missing something? And is our system able to digest that information effectively and make it meaningful?
Absolutely, all good answers. Actually, one of the next topics we're going to discuss has to do with the Internet of Things. It seems like everywhere you turn now, there's a device that's processing some level of data, that's pushing data from point A to point B. And in most cases, we're still trying to figure out how to actually use the data that's being generated from those devices, or even if it's worth it to any degree whatsoever. So my question to you is, how can the Internet of Things be leveraged for participating health systems in sharing data for smart purposes, and not just for the purpose of saying I was able to move X amount of bytes from here to there?
So as an example, we'll talk about a traditional clinic visit where as a clinician or a physician, you have approximately 7 minutes with your patient. 3.5 of those minutes are spent typing data into whichever EMR is sitting on the screen in front of you. As a part of that, you're supposed to get a complete picture of what's going on with your patient in those 3.5 to 4 minutes that you have, and be able to go ahead and diagnose and prescribe and understand what that picture looks like. That, and with every patient that walks through the door, I'm sure they're 100% honest with you about their smoking habits, their drinking habits, their exercise habits. And if you're male, you show up when body parts are falling off of you, and that's the only time you show up at the clinician. Totally understand it, totally get it. Not that way, but I totally understand it. But as a part of that, how do we get a better picture of what's going on with that person in their normal daily life? We talk about the Internet of Things and what are we going to do with all that data. Yes, the data deluge has been threatening from a clinician perspective because if you collect it, you have to look at it. You're responsible for looking at it. How do we understand what is normal for Christian, what is normal for Steve, what is normal for Taylor here? It's all going to be different based upon our body types, based upon our genomic makeups. So how do we bring that picture together? The picture itself is just beginning to become clearer. Yes, we can use IoT data in a number of ways. How do we make it actionable? We need to utilize the tools that are given to us to understand, first of all, what's normal for that patient. We talk about it from a machine learning perspective and utilizing machine learning to define what is normal for that person by studying them for some period of time and actually learning about them. Once we understand that, we can start to put up some guardrails, and it'll be fairly wide as to what falls into that category of normal for whatever we're monitoring, and really start to bring back more information, surfacing only the actionable information, things that we need to take an action with or be responsive with. Taking it even further than that, there are many capabilities that are coming from a technology side of things. Imagine what would happen if you could conduct gait analysis in a patient's home and be able to understand what happened, what their gait suddenly changed, what happened with them, and be able to detect that without being intrusive, without being invasive in their home, without breaking into their privacy, so to speak, by providing appropriate images and appropriate information about their gait, and just being able to understand what's happening with that person. Let them stay in, perhaps for an aging population, let them stay in their homes longer. I mean, IoT offers a number of possibilities. We have to be actionable and very smart about how we utilize the data.
And a lot of it is also a balancing act, right? Between able to collect
Absolutely.
the data and actually pick up, the services to offer if something was to be found.
Yes.
From that perspective. So.
Yes. To me, the home speaker market is something that I'm terrified of. The information is collected 24/7, 365, and not necessarily utilized in an appropriate manner. It's something that has caused a bit of pause from an ethics perspective, and I'm glad it has. But with that, how do we go ahead and, again, start to utilize information that we're collecting in an appropriate way?
Yeah, and I think you made some fantastic points, especially when it comes to elder care, being able to age in place, being able to utilize existing technology, not necessarily to create a whole new wave of data or a new wealth of data that we might not necessarily have time to interpret or understand or read or whatnot, but being able to work with what's already there and using existing tools to be able to allow someone to just give them a heads up about, hey, you need to take, don't forget to walk this many steps, don't forget to take this medication. Gait changes, there's an increased risk of falling in the home, something like that. Yep. And then also going into the hospital. One of the companies that we're working with called Stasis Labs is imagining a world where there can be a nurse at every bedside 24/7. And all they're doing is being able to leverage tracking vitals 24 hours a day and using Internet of Things, AI, to be able to give a nurse a 20-minute heads up that, hey, there's a likelihood of this person needing increased care or needing you within the next 20 minutes. And I think that I see us going in that direction.
Mike, any perspective?
Yeah, considering that last topic. There's a lot of different ways we've seen IoT come into this space. I mean, with the large volume of information gathered, you kind of flip over into the AI and machine learning side, where you're trying to develop patterns over large volumes of information to determine what you're seeing. But then we've seen some things that are just really fundamental, qualitative. We've worked with a blood bank, for example, that wants to somehow RFID or tag a bag of blood from somebody's arm to wherever it gets to. Is it being maintained in the proper temperature and shipment? How is it tracking? How do I know it's correct? Another complete other extreme is a hospital that has, which many of you probably also have, large volumes of very expensive portable medical equipment that are in your healthcare facilities, and just the ability to track where it is, where the closest one is, what the traffic patterns are, where it moves, because you see these going around in these facilities all over the place. Somebody just leaves them someplace. And not only being able to get the better service to your customer because you know where something is and you can provide that service quicker, but also better utilize the assets that you have, maybe not have to buy as many, that type of thing. So it's kind of across the board.
Yeah, I think facilities struggle with governance around what to do with this data, right? It's a very difficult thing to define an algorithm. And in the messaging in the last panel, it's a lot about respect, right? It's respecting the various clinicians, right? It's respecting their process and how they process medicine and science as it comes out, both new and old science, right? Because that's an ever-changing landscape. So I think as AI develops, you're going to still need those clinicians to be engaged in those algorithms, right, to make sense of this data. And it really comes down to, if my emergency room is getting all this information from patients, right, are we prepared to respond to that data? Do we have the infrastructure and support to respond to those people that are going to be an influx because we have more sensitive information from those patients? And that needs to be aligned, right? In our practice, in our process, it comes down to data governance. What are we trying to solve? And that's what was mentioned this morning, is what problem are we trying to solve? And then when those systems fail and we have a case or an instance where it fails, it's really important that we close the loop and have technology learn from us closing the loop. This was something that was out there, data that was out there that our system did not catch, right? They were wearing a watch, they were doing, and the data was there, and we missed it. Well, our learning needs a human push, and a clinical human push as well.
Right. So a lot of data discussions, right? Collecting from devices, going from point A to point B. Somebody has to action something as a result of collecting all that data. But at the end of the day, where are we working on standardizing how we ingest this data? How do we collect and identify the basic elements that we need to actually, capture from these devices? And then if you think about that half of the question, how are we working with our vendors and partners and innovators and whatnot to create an environment where we actually make the biggest impact on our patients, our clinicians, the payers, all these folks. So from earlier in the panel before us, they talked about, paperwork and 15 different forms and so on and so forth. Can we work and develop a technology that captures all these elements so we can avoid the need for paper, not go from 15 to 7, but go from 15 to 0 potentially, but yet not lose the function that we're trying to get accomplished here?
Okay, I could just, if you don't. Go ahead. What I see in other industries, and again, I don't come from healthcare in my background. I come from insurance and not health insurance. So I was always looking for other industries that were smarter than property and casualty and others. So I always looked at from other angles. And what I see from a recent event, there was a recent conference I was at, it starts with governance. Overall healthcare governance, and even with the group that was up here last, is very provider focused, very physician focused, and there's more pieces to the puzzle than that. And it seems like to be able to get to the future in healthcare space, you're going to be able to have to bring all those groups together to agree. Because another thing I'm seeing in other industries is standardization. people, there are standards out there, standard data formats, some attempts at them in the past anyway. And how do you get, some sort of concurrence there? And then the final thing is there's so much power by some of the EMR vendors that, some issues there.
Yeah, I would say that we've gone through the landscape of being patient-centered, and then it was kind of to overcome the physician-centered. I think the messaging probably needs to change. It's results-centered. I mean, we need to change the language from picking one, because even as they mentioned this morning, is you have an efficient physician, and they can take care of twice as many patients and have twice the impact, right? So in my mind, Internet of Things is a piece of the information that the provider needs. But the best value, right, is when we start changing our electronic health record system to be less present in the rooms that care is being provided. Meaning, I'm engaging with my provider, and I see a board that has my image, that shows all of my history, right? And he's educating, or he or she is educating me on my particular conditions, taking various factors out of that view of me, and educating me while the system documents. I mean, if we can get to that point, we now have the engagement between the provider and the patient being an education-based, and then the data is then recorded in a manner that doesn't take away from that personal connection. I think that's the vision that we need to go to, and innovation is tough. It's going from A to B that takes a lot of effort and energy, and IoT is one of those things that is really a piece of the picture, but obviously the focus on engagement with the doctor and the patient is the highest priority.
Yeah, Taylor, before you jump in here, I think part of the message that we sometimes miss is defining impact, right? So the question was, what makes the biggest impact on the providers and the patients and payers? And all excellent points, but I think it's also the perception of what we believe that impact, is causing or has on us, if you would, as the recipients of that change. So if you can answer from that perspective a little bit as well.
Yeah, I'll give it a college try. I think just kind of starting bigger picture, one thing that I really love, also not coming from the healthcare industry originally, one thing that I really love about working in this industry is that virtually everyone in it really cares passionately about what they're doing and about trying to improve the status quo, and trying to make the experience better for patients, for innovators, for payers, for providers. I think the challenge is that as much as we all collectively feel what needs to exist, it's really hard for us all to realize that and to see it, and then to all be looking in the same direction at the same time. And so we run into a lot of challenges around collaboration and communication that I think we need to see more of. If we want to be bringing in more blockchain or more IoT technology, going back to your original point, into the health system and being able to work with providers, work with payers, really get to that end goal that we all want to see, we need to have more buy-in from top to bottom, and we all need to be able to say, like, yes, this app, this tool, this product is the right one, and we're all going to move in this direction. Because if we don't, then it's just going to lead to more data silos and more fracturing and less results.
Steve, any perspective on this?
Definitely some perspective on this. As we look at this, because we live in a free market society, because we have innovators that come from many, many different areas and different directions, and part of ScaleLA's approach is to really incubate some of that. We're going to develop silos of data. The challenge to me is, how do we break down the silos of data without actually breaking down the silos of data? And be able to provide things like federated analytics, or be able to gather data from 15 different sources with one query, if for you as a clinician or an informaticist, to be able to bring that information back, being able to normalize it in that same process and utilize it to figure out what's going on with your patient. I'm very, very fortunate in what I do in my role, because I'm very passionate about healthcare. I have the luxury of being able to work with very new technologies that are not released to the world yet and start to play with them and understand what they can do. But some of these things are coming forward very, very quickly. I believe by this fall, the ability to go ahead and analyze data from 5 different health systems, assuming you have the rights to go ahead and do so without having to move the data, will exist. It's coming. I assure you it is coming. I'm just not sure timing-wise.
Is that a breakthrough you're telling us about?
It is something that
Do you want to call your lawyers to check if you can say anything there?
I can't go a whole lot further is the challenge.
So,
It is very interesting. It's one of those steps along the way that will give us the opportunity to really change how things occur. Talking about blockchain and blockchain architecture, yes, it can be utilized. I have a goal in my life, and that is to be able to see data actually in the hands of the data owners, being the patients. Being able to have them control, define, and provide access for that data to whom they need to provide it for, at the time they need to provide it, without having to gather it from 15 different places. I've walked a very seriously ill patient through care and actually to their grave, and with that, how do we go ahead and bring those pieces of information together so that we don't have to go run around and collect 1,000 different sheets of paper, 5 different medical records, et cetera, in order to bring the information there?
no, absolutely. So the more and more we go to the EMR world, it seems like the more and more we have to hold on to more data, sometimes even in paper format and other functions of that nature. So the world of apps, the healthcare apps or any apps that maintain your personal data that you can exchange at some point or provide to somebody at some point, causes a non-linear data flow to take place, right? Because now you're taking it off to the side, you're keeping it, you're taking it from point A to point B to somebody else, and then all of a sudden that traditional, I have your chart, I have everything in your chart, is no longer the case potentially, because you may have your, some elements about you that are in systems that are not in others. Mm-hmm. So do you think all that data flow that's taking place today for all the various different apps that we have is working correctly? And if it is working correctly, why? If not, is it causing data silos that we need to better manage and maybe put a standard process around it?
The data silos definitely exist. Data is the new oil for the U.S., at least at this point. Not so much in other countries, but in the U.S. very much so, in that it has been a land grab to go ahead and collect and hold the data. Because it can be monetized, and there is money to be found within that data, believe it or not. With that, the ability to go ahead and share data in our current market and current scenarios is limited at best. Yes, we have the ability to go ahead and sort of share a little bit of information from EMR to EMR. It sort of exists, it sort of doesn't exist. If you ask the big players, they'll say that they're interoperable with each other. They're really not. And the amount of data that is stored about that person or patient is limited to that episodic intervention that has happened inside another EMR. Things like FHIR and HL7 were designed originally to go ahead and make data shareable. Well, it depends on whose implementation of HL7 or whose implementation of FHIR you're going to work with in order to determine how well that standard is actually followed. Each one varies just a little bit. There are challenges there. No different than what you're going to see with the IoT data. You're going to see this with healthcare. You already see it with healthcare data. You're going to see it with IoT data. You're going to see it with all forms of data. To me, the challenge really is how to be able to create those communications and create those integrations between the environments.
And I challenge this group as to whether or not the industry really believes that. Because I think of an analogy, the analogy I use is like a property deed. You buy a piece of property, you get a stack of paper this thick, and it goes all the way back to when dinosaurs roamed as to what happened to that piece of land, And it's all sequential, and it all happened linear and just in the order it occurred. And I think of people being the same thing. By the time you're born, all through life, there's those activities that occur, regardless of what hospital you had, whether you live, what condition you had, what medication, And it's all that and that would be what I would consider a healthcare wallet for someone that would follow with you. Now again, what's in an EMR system and all that kind of stuff, they could pull from that from reference or whatever, but if you really own the data, you'd have that at your disposal, and you'd focus on that rather than solving it other ways.
Just a quick interjection, Jason. So, Mike, do you think that the way our clinicians and our various different practitioners and whatnot consume the data in a similar fashion, that we can trust the patient to have their own data and still be able to provide the same level of care for them?
I think I use the example, I flipped the example to like your financial services. Most people, probably all of you, have more information on a monthly basis on documents you get that shows exactly what your holdings are, your net worth is, your positions, even through time. But a lot of us aren't really capable necessarily of managing our own money to the best extent possible. So you'd still have your wallet, you'd still use a healthcare provider to examine that and say, and I've got an aging father, he would not be the person, but you've got your own group, but at least you've got this common point of reference that has the truth in it. And I'm not going from hospital A to B to clinic this or that to radiology place here and there. I've at least got that information at my disposal.
Thank you, Jason. Sorry, I cut you off.
Just to talk about EHRs and EHR vendors a little bit is there's, it is very, very disruptive to change electronic health record vendors. I will say that over and over again. So we're hoping the technology that comes, right, gets us there. But even as they talked about this morning is when you deploy an electronic health record, they're going to let you make some decisions. And a lot of time, you're not familiar enough to the impacts of those decisions as you're setting it up. So there has to be some level of socialization, right, amongst all of the EMR vendors to say, we're going in this direction on these particular things because it has a better impact on society, on how we exchange records. There has to be that push amongst EMR vendors to participate in that type of structure discussion. So they call it different things. They say baseline configuration for one vendor. Another one, it's model experience. It's pushing you in a certain direction. So you have a shared responsibility where the patient takes responsibility of some things, but then there has to be some responsibility on the people that know how the system works. One of the biggest barriers we had to making changes to our electronic health record was really understanding how the system works. Have you ever heard the phrase, it doesn't work like that, when you're trying to make changes in an electronic health record? It doesn't work like that. It can only be battled by bringing the folks that understand the specifics of how the system works first into the same room with the clinical decision making. And then when the clinical decision makers and the IT professionals that know how the system works are together, that's where magic happens, right? And the important thing is that can be done on a larger scale, right? And then those best practices can be shared across systems, and we don't have to face major changes in electronic health records that a solution, whether it's API-based or something else, hopefully in his secret world that a solution is coming, so we don't make those major impactful moves, to change how we practice care, but rather start to normalize within our existing vendor solutions.
Very well said.
I think that's such a big point, like making sure that each of the stakeholders who represent each aspect of that knowledge base are in the room and are all bought into finding the next best solution. Because if one of those voices is not there, you're not going to be able to move the ball down the field.
I think it's going to take some real disruption in the EMR world in order to pull off what you're thinking of. Unfortunately, for most of us, and I would hazard a guess that about 85 to 90% of those practicing clinicians are practicing within Epic today. The rest of you are either practicing within Cerner or a Meditech solution. Most of them are over 25 years old at their core. And older in some cases. Like Meditech just celebrated its 50th. And with that, because the technology is still built on that 25 to 50-year-old approach to technology, it's not necessarily capable of providing the services that you're looking for out of it. I think that the disruptors are in the wings right now. I watch the market very closely. I spend a lot of time analyzing and understanding it. From my perspective, I think that, as I said, the disruptors are in the wings, and there are about 4 or 5 of them that may soon, very soon, come forward.
Yeah, I just would say that, yeah, a lot of those disruptors are lucky enough not to have legacy data, right? I mean, the reality is they're starting from scratch, and they can leverage all of those technologies from here forward. We need to be able to leverage that, right? How do we leverage those disruptors coming in, have them educate us and optimize us in the most efficient manner? We do have some of those disruptors that are engaging with our EHR vendors. And we talked about it today, is going to web services, going to advanced web services, and taking those existing solutions into that brings those together. So there's partnerships going on. I just don't think it's fast enough, right?
And the truth is nothing is fast enough in healthcare, it seems like, because we're hesitant to take a giant leap when new technology comes in. But the one aspect of what we're talking about today, whether it's apps, whether it's data flow, whether it's, exchange of who owns the data or whatnot, the element of security. So from a cybersecurity standpoint, as we enable the patient to have more control, as we open up more and more integration into the EMRs, truth is healthcare is one of the most thought after industry from a cybersecurity, penetration standpoint. And the ability for us to guarantee the security of our patients' data, or guarantee that the delivery mechanism is being managed correctly, is a very large undertaking. So what should be considered when we're talking about these services and how we protect the data to put our patient's mind, our clinician's mind, our service provider's mind at ease when that's happening?
Christian, it's a very challenging question that has a multitude of answers, and it really is going to be, we're going to peel back this onion one layer at a time, and it's an onion about the size of this building. You're laughing about it, but the truth is that protecting your patient's
Just
data...
picture the onion, Steve, that's it.
Okay.
Go on.
The truth is that the data is very valuable. The data is not my primary concern right now. People have gone after and created new forms of attacks that I've heard of a patient respirator being taken control of, and someone trying to either get their ransom money or eliminate the patient. Not a pretty sight, not a pretty conversation. So as we think about security, security has to be everywhere. It has to be built into everything that we're doing. It needs to become a very ubiquitous part of everything that's provided. We talked about some of the advancements coming forward from a communications perspective and a technology perspective. I think as you look at where the future state network communications are coming forward, you'll find that there will be technologies in there that we can utilize to provide security. There will be technologies in there to provide privacy. We'll be able to enhance and provide a high-performance blockchain, which has been one of the challenges and hurdles about blockchain delivery in any form up until today. Although there are those that think they have breakthroughs on that. But as you look at security, it's on every aspect of what we do. And so far, the banking industry has been managing through a little bit of that. They still get hit, and they get hit pretty hard every year. And healthcare will continue to be hit because every time we create a new hurdle, someone will find a way over it. It's hurdle after hurdle after hurdle until they're no longer interested in or find it no longer valuable to spend time chasing that information.
I think part of the challenge for the rest of the panel, if you can respond to this too, is that we think of security maybe as a foundational element, and I personally completely disagree with that. I think security should be to the side, because security needs to apply at all levels, not just as a foundation, because if you do it on the foundation, you tend to miss all the other layers on top of it. So Mike and Taylor and Jason, if you can respond to that.
I mean, it is all layers, and it's also, I mean, I've got younger kids, younger than me, so, but, and it's just a way of life. I mean, I think the thing that I've seen the most in healthcare providers is, I was doing work on resiliency, disaster recovery, those threats that were traditional things everybody worried about. And I'm on a retainer, annual retainer, and almost the last 3 years, everything has shifted to patching, incidents, tracking, security, and it's just endless. And the volume of information, if you're talking about, you know, IoT and those kind of things, just the volume of information. If you take any let's say, forget about healthcare organization today, the volume of most organizations, the predominant amount of share is in logs of information that's gathered from monitoring mechanisms. I mean, people have data lakes where they're dumping their information. It has to do with security. So I do think it's pervasive, it's long, and it's one of those things that has to be baked into every solution. We talk about this when you're building a new solution, buying a new system, whatever it is, project management, whatever. It's ingrained in everything you do as far as evaluating it.
Thank you. Jason or Taylor?
So the healthcare industry is an interesting industry, right? We have seen, heard the analogies and comparisons to the banking industry that has a pretty simple, money's there, it's not type of methodology, and it's much more complex. Everybody has a bank account, well, a large percentage, right? But also everybody has a health record, right? And everybody has a patient experience, and everybody has the advocacy for their own health. So that makes it a very interesting industry. In addition, the people that are, on the front lines, we say, turning the wrenches, right, are your most expensive assets, right? Your physicians that are taking time to handle all of these patients and process all this data need the most assistance to be efficient, right? And it comes down to, that term of respect, right, of we want to respect these security, resources that are out there and get those best practices in there. But you have to also respect that clinician and the delivery of the care as the top priority, right? And security is a means to an end. We secure to prevent penetration. We deliver to improve wellness.
Absolutely, and it's always going to be a balancing act as we go through this journey. So for our last question, where do we see blockchain emerging in this technology and really helping apps develop? Maybe we'll go to Mike first and then Taylor, since Mike, you know a little something about blockchain, I heard. I was kidding.
So we've worked on a number of different use cases. The most recent, they actually did a proof of concept, a white paper that's been published with University of Chicago Medicine that had to do with, they used the term health information exchange, and basically it was a case where you were basically data that followed, and it was patient data on the blockchain. It was used for not only onboarding with other member hospitals, but other geographic affiliates. It was a very subset. It was just around basically allergies and medications for the allergies and tracking. Certainly to track a full section would be far broader than that. But again, the problem you have there is the disruption that creates, because there's health information exchange organizations. We've used the flip of this with the blue systems, because they have to clear claims across different states and through the blue systems. But there's also an entity that does that, and they get paid to do that. They make money doing that, just like with HIEs, and it's disruptive to untangle that. Just like the other things we've talked about, it's disruptive to health, EMR vendors. I mean, they're the pretty dominant players. We saw it in more of a supply chain incident with, I think I mentioned it already, the blood bank. And that was from what they call vein to vein, which is, where does it go, the whole train? And that's RFID tagging and tracing. In that particular case, somebody had, a bad batch of bags for the blood. And they wanted to know where all those were. So it's not different than chasing down the romaine and all that type of thing. As far as security specific, it's not so much, we really in all the cases we've worked in any industry, we don't think of security first. In most of these cases, you're dealing with a permission to blockchain, which means the participants. There's security around that. There's encryption within the chain, but it still has the exposures that we've already mentioned here that could be hacked as well.
Taylor, any opinions?
Yeah, I mean, I'm certainly not a blockchain expert by any means, but I think that I get really excited about what is possible from the standpoint of vein to vein, from tracking down bad romaine lettuce, from EMRs, all of that. I think blockchain as a core technology really can address a lot of the things that we're talking about here. But I think the challenge just comes back to education on what it is and how it can be used. I think blockchain kind of suffers from this connection with cryptocurrency and it coming across as something that's shady or not understood or whatnot. And I think the more that we can do to separate those two concepts and allow blockchain as a core technology to live on its own and be understood and implemented into a lot of what we're talking about here, the sooner we can do that, the better.
There's usually two swim lanes in the blockchain front. There's the Bitcoin, crypto, and then there's what they call the enterprise blockchain, which is really more process. It's cross-enterprise process, and its best value is when it's really across entities and not internally used.
Absolutely. You want to?
Again, not a blockchain expert at all, but we're looking at use cases for blockchain, and we're always kind of focusing on, accountability, right? Making sure we have, control of our bloodstream and all of the different assets that are out there, equipment that could be somewhere else or, found at another location. All those things are really good use cases. And it's hard to use, patient-specific information in a blockchain due to privacy concerns, right? So I think there is somewhat of a limitation that I've understood. But some things that relate to care and patient care is kind of that evidence-based medicine consensus, because blockchain is really built on how do you gain consensus of a wide audience, right? And some of those things, looking at medication management and clinical decision support, is not specific to the patient. It's specific to science, right? So how do we take science, right, and the discoveries that they're making, and then bring that into clinicians' view with a consensus building around each specific specialty? Orthopedics, there's allergy medications that have been used in orthopedics to solve specific aches or specific problems, or vice versa, where orthopedic medications help someone control diabetes. I mean, that's a ridiculous thing from a clinical perspective because I'm not a clinician, but the idea is gaining consensus across the science that is being produced and have it impact what is presented to providers. Maybe an opportunity that people are looking at.
One of the downsides of the rigors of blockchain is rules are rules. And the past panel was talking about practice. Well, practice and blockchain don't lend themselves very well because smart contracts are written, here's how you do things, and you're doing it this way every time. It's not, this doctor decided to do it this way, this guy did it another way. Presented the rules and all the triggers, and you run it through the smart contract, this is the outcome that's going to be, and it's going to be the same every time, not practice. So that's cultural difference.
Absolutely. So we are running very short on time. So